Hello, today we're going to discuss the difference between primary and secondary research with examples from injury and rehabilitation. So let's start looking at primary research. So primary research involves the collection of original data directly from sources. This type of research is conducted by the researcher themselves, and the data is specifically gathered to address a particular research question or hypothesis. Some methods that could be used are surveys, experiments, observations, interviews, and clinical trials. So examples from injury and rehabilitation. So clinical trials, conducting a randomized control trial to test the effectiveness of a new therapy technique for patients recovering from ACL surgery. So researchers directly interact with participants, collect data on their recovery process, and analyze the results to determine how effective the technique is. Surveys and interviews, so distributing questionnaires to patients who have undergone different rehabilitation programs to gather data on their experiences, challenges, and outcomes. This primary data helps in understanding the patient's perspective and improving strategies. So a primary research study might involve observing athletes during training sessions to document the types and frequencies of injuries they sustain. Within rehabilitation, a primary research study could involve measuring the recovery process of patients using a new rehabilitation device, collecting data on their physical improvements over time. So looking at secondary research. So secondary research involves the analysis and interpretation of existing data that has already been collected by other researchers or organizations. This type of research uses previously gathered information to answer new research questions or support new analysis. So methods that could include this are literature reviews, meta-analysis, systematic reviews, and existing databases or records. So examples in injury and rehabilitation. So literature reviews, conducting a comprehensive review of published studies on various rehabilitation techniques for ACL injuries to synthesize current knowledge and identify gaps in literature. Meta-analysis, so analyzing data from multiple clinical trials on the effectiveness of different rehabilitation protocols to determine which is most effective for reducing recovery time and improving function. So using existing injury reports and databases from sports leagues to analyse trends and patterns in sports-related injuries over several years, or reviewing patient records from a hospital's rehabilitation department to evaluate the long-term outcomes of different therapeutic interventions. Both primary and secondary research play a crucial role in advancing the field of injury and rehabilitation. Primary research generates new data and insights specifically related to current questions, while secondary research helps contextualize these findings within the broader body of existing knowledge. Combining both approaches allow researchers and practitioners to develop evidence-based effective strategies for preventing injuries and optimizing rehabilitation processes.